right. Thanks a lot for inviting me, and thanks for organizing this workshop. So the presentation I would like to give today is about an ongoing study exploring the impact of parity on cognitive function using instrumental variable approach based on the evidence from the one-child policy in the Chinese context. So I'm Yan. I'm an assistant professor at East Carolina University, and I want to introduce my wonderful co-authors, Dr. Wang from University of Wisconsin in Madison, and Mr. Li, who is a master's student from Columbia University. So this figure is a report from the Lancet that it reports 12 potentially modifiable risk factors that account for about 40% of dementias worldwide. So we can see from people's like early life, the lack of education, to their middle life, such like hearing loss, hypertension, drinking, obesity, to later life factors like smoking, depression, social isolation, air pollution, diabetes. So those factors account for about 40% of dementias worldwide. However, at the bottom of the figure, we can see there about 40% of the risk of dementia is unknown. So as a medical sociologist and also family demographer, I wonder if there's any family-related factor or like demographic level factors can contribute to people's later life cognitive function or risk of dementia. So this is a starting point of this group of project. Then the next question is why China? So China has a large population, and now it has more people with dementia than any other country worldwide. The prevalence of mild cognitive impairments, what we call the MCI, among Chinese over 60 years old is about like 50%. So it's a large percentage, and about 38 million people affected by it. So at the same time, China has this unique, the one-child policy, and one-child policy was implemented in 1979 and relaxed in 2015. It has a significant impact on fertility rates in China. And now China has the historical low fertility rates, about like 1.28 births per woman. And this is quite below the replacement level of fertility. So in this study, we aim to explore whether a number of children influences older adults' cognition in China, and we want to leverage this unique social context of the one-child policy. The reason we want to focus on this question is that we find those like previous studies focusing on the association between parity and cognitive health barely show the causal relationships. There's some like literature using the HRS sister data based on different social contexts, but we barely see those studies using causal methods. One of the publication on demography that was published in 2022, they used the instrumental approach, and their IV was measured by the sex composition of the first two children. So they explore how number of children influence later life cognitive function. And the idea is they assume like parents with their first two children are same sex, like two sons or two daughters may have are more likely to have the third kids. So using this IV, they explore this association between the causal effects of number of children on later life cognitive function. And the data they use is a shared data based on the European country context. So in short, our research question is whether we wonder if a number of children influences older adults' cognitive function in China. So basically, this is a question about like whether having more kids is a potential risk factor or a potential protective factor to older people's cognitive function. Why or why not? So a brief introduction about the current literatures in this area is fertility influence people's health in later life. But there's different measures of fertility or fertility history, such like timing of childbirth or birth intervals. So for example, like this study shows women who had been teenage moms had higher mortality or poorer health. And also like mothers with short birth intervals have increased risk in some cohort. And a famous study conducted by Mirowski and Ross find association between early age at first childbirth and depression. And we would like to focus on one of the measure of fertility, which is parity or number of childbirths. And there's also studies find there's association between parity and health. For example, like this J-curved relationship between parity and mortality. So both low parity or high parity is associated with high risk of mortality. Then our next question is why question. So what are the potential mechanisms that can link parity and cognitive function in later life? So existing literature often uses two frameworks to motivate this linkage between parity and cognitive function. One is called the biological pathway, and the other one is the social pathway. So the biological pathway or the biological mechanisms applies to women only because pregnancy is a unique female experience, and women's number of pregnancies is a key proxy for cumulative estrogen exposure. And some studies find that this cumulative estrogen exposure plays an important role in regulating women's neurobiochemistry and can account for women's brain aging and cognitive performance. Also, women's pregnancy and number of pregnancy influence their like physiological changes, and this can affect mothers' comorbidities such like diabetes, risks of cardiovascular disease or depression, and those are factors can potentially influence women's later life cognitive performance. So some studies focus on these like social pathways, and this can be a little bit complicated. It applies to both fathers and mothers. So some studies call it like indirect pathways. For example, like childbearing can influence parents like multiple dimensions of their social life, such like their economic resources or labor force participation. Number of children can influence like a mother's career choice or their marital stability or like the social interrogation. And those factors can have like implications on cognitive function. And also family demographers describe a parenthood experience as a mixed bag because it involves both cost and benefits. And this from like a life course perspective, this perspective emphasizes this linked lives between parents and children. So there's a strong bond or this interdependency between parents and children can have implications on parents' health, especially the cognitive health. Some other potential mechanisms in these social pathways can be adult children are the central figure in parents' social network that can increase their social interaction, engagement, and that can protect cognitive function because that promotes mental stimulation. A hypothesis called like a brain reserve, basically saying people's brains like use it or lose it. So this increase the social interaction with people in their network can increase their like mental stimulation and can be a potential protective factor on cognitive function. And the last point is in parents like later life, adult children are their primary caregivers, and they can provide this intergenerational support both emotionally or financially, and that can be a factor linked to their cognitive function. So because this like the nature of these biological and social pathways, we use this a gendered and life course perspective to guide our research. But we don't aim to explore these mechanisms one by one because we don't have sufficient measures for each mechanism, but we just want to explore the causal influence of parity on cognition. So a quick introduction about current literature is that existing literature is far from conclusion on this topic. Some, I would say like a large group of studies find there's a U-shaped relationship or a J-curve between parity and risk of cognitive impairment. So both low parity and high parity are likely to not good for parents' cognitive function. But a small group of studies show there are protective effects of high parity. Because that's kind of like a longer time of cumulative exergen may have some protective effects. And also some studies find there's no such association between number of children and cognitive function or risk of dementia. So in this study, we use the data from Charles, which is the China Health and Retirement Longitudinal Study. We use 4 waves from 2011 to 2018. And the final sample includes about 22,000 respondents. Parity was measured by number of living biological children, ranges from 0 to 12, and the mean number is about 3 kids. And outcome variable is the self-reported cognitive score from 0 to 30, including like measures of a mental status and episodic memory. So there are some like words recall questions or some numeric reasoning questions. And we controlled both like parents' demographic information and also their economic resources and health factors. And we use this instrumental variable approach. So this every approach, the basic idea is the one-child policy is hypothesized as an instrument in this study because it has a direct and causal effects on number of childbirths, but there's no direct effects on cognitive function. However, we find it's challenging to measure the one-child policy. We reviewed many existing literatures like to see how different articles measure this one-child policy, but we find there's a golden standard in measuring this one-child policy. So instead of picking just one measure, we conducted a comprehensive review and tested many potential IVs, and we summarized commonly used measures of IVs, such like type of hukou, which is a measure of whether people living in rural areas or urban areas, and that influence their the number of children. For example, like parents who are the rural citizens, they are allowed to have the second kids if their first kid is a girl, but that is not allowed in city for the urban citizens. There are also other measures like ethnicities. There are differences between minorities and majorities, number of the first children were, gender of the first children or the gender of the first 2 children, and also the established year of the policy. So this is a table summarizing all the instrumental variables we use because they passed the first stage F test. So I know there's a lot of information, and this is a list of all the IVs we use for the second stage. So this is a table showing all the instrumental variables for the total sample. We can see this sample size vary a little bit by different IVs we picked. We also test whether this F test results, how this F test result look like by gender, and this like analysis by gender show similar test results. So they are the IVs we use. And the second stage results are things we want to look at because they are the coefficients showing how parity influences cognition. So we can see this is a table showing both the result by total sample and by gender. And these coefficients vary by different IVs we picked. So we were trying to summarize a general pattern on this, so like the causal effects of parity on cognition. And the general pattern here is we find most coefficients are negative, indicating high parity may negatively influence cognitive function. However, we're trying to find gender differences, but it seems like we cannot draw a clear conclusion about this gender pattern, or the gender difference is not quite clear here. And we would like to know more comments if you have any thoughts about it. So, so in short, we find a pattern that high parity may lead to worse cognitive function, and this is evidence consistent with many our literatures using the HRS sister data. And we think it's likely due to the similar cohort of this HRS sister data, and also the declined fertility trend in those countries like European, American, and China. So a take-home message, we think instead of saying, okay, because I want to have like a good cognitive function, I should have like 2 or 3 kids. That's kind of quite a simplified conclusion. We were trying to draw a broad implication, such like thinking about older adults' cognitive health in low fertility countries. And based on this like shrinking family size, who gonna provide care, and whether their older adults' care needs can be met, and also how this low fertility and smaller family size influence their like a social isolation. There's also some implications on the impact of fertility or family planning policy on health in later life. Some future directions can be we think maybe we can explore this relationship quality between parents and children, and also just a focus on the difference between childless people and parents, and also the interaction between marital status and fertility history, like unmarried people with kids, married people with kids, kind of like the typology of child rearing biology. Yep, that's the end of the presentation. Thank you. And I'm looking forward to your questions.
Terrific. Thank you.